If you've been diagnosed with a mental health problem and you've been to see your doctor and had some treatment, whatever level it might be, it's really important that when you get pregnant and you have your booking appointment with your midwife, that you talk to her about it and tell her exactly what the problem was and what treatment you had, whether you were in hospital or not. So just give her the full detail. And then what she will do is assess the situation, and she'll obviously ask how you're feeling now, but she may feel that it's important to refer you to another doctor, either an obstetrician or a psychiatrist, depending on what degree of mental health problem you had or have. But those between you, you'll make the right decisions because you can chat about it, and the important thing is that you tell her. And when you go to see a doctor, or if you have to go to see a doctor, then they will monitor how you're feeling and how the pregnancy is affecting that underlying problem. But usually you are given sort of a care plan to help you through your pregnancy. That goes from absolutely doing nothing at all any different to anybody else, except just keeping a check on how you're feeling and taking note of whether you feel down at any particular time and making sure that you tell someone about it, to actually being on medication. So it can go from one spectrum to the other. So it might be that you need to take tablets. Now, sometimes women worry about it, so that you might be worried about taking tablets when you're pregnant, and certainly your doctor will talk to you about that. And if you're referred to a psychiatrist for some support during your pregnancy because you've got a severe mental health problem, then you'll talk about all these implications. And it might be at the end of the day that you have to do a little balancing act, because if you are worried about taking the drugs and about the effect it's having on the baby, that might be as problematic as actually the mental health problem itself. So, and if you stop taking them, it might be that your condition gets worse. So your doctor will talk about the advantages and disadvantages of taking medication and help you to come to a decision, sort of a joint decision between you, your family, and the doctor as to whether you continue taking it or not. But usually it's a decision that's made well because there are all parties involved. So don't worry too much about it. Just make sure that you tell everybody your full history, and then they can make the right decisions with you, alongside you, and make it that's best for you and your family.